Good day. My name is Christopher Alabi, first-year internal medicine resident, training at the East Florida GME program, at the Westside Regional Medical Center, and the Northwest Medical Center, both in South Florida. My topic today is a case of spontaneous tumor lysis syndrome secondary to aggressively proliferating multiple myeloma with a Ki-67 index greater than 80%. This is a case of a 57-year-old obese woman with a past medical history significant for hypertension who presented with generalized abdominal pain of 1 week onset and progressively worsening fatigue of 1 month. Physical examination revealed hepatomegaly and splenomegaly. Her labs revealed anemia, thrombocytopenia, and renal failure, along with hyperuricemia and other chemical abnormalities, fulfilling the clinical criteria for tumor lysis syndrome. No abnormalities were reported on skeletal survey, and no masses suggestive of plasmacytomas were seen on her liver and splenic imaging. Empiric management of her symptoms were resumed immediately while awaiting results of bone marrow biopsy and immunochemistry. However, her conditions only got worse. Bone marrow biopsy results were in keeping with multiple myeloma, and kappa lambda ratio was 0.001. On immunochemistry, her Ki-67 index came back greater than 80%. Plasmablastic lymphoma was ruled out through the molecular FISH test and Eber stains. Cyclophosphamide, bortezomib, and dexamethasone therapy was initiated, along with hydration and alkalization therapy. On the third day of the first course, she developed severe thrombocytopenia, disseminated intravascular coagulation, hepatic failure, and renal failure. As a result, she developed metabolic encephalopathy. She received courses of dialysis and additional packed red cells with serial platelet transfusions. She was transferred to the ICU. She was intubated and given all necessary supportive treatment. However, she sadly succumbed to the overwhelming complications of her illness. An autopsy was declined by her relatives. Given that multiple myeloma is known to be a hematologic malignancy that often runs an indolent course and which fairly responds well when treated early, this case proved to be an aberration of the known biology of the disease. To the best of our knowledge, this case has one of the highest Ki-67 scores reported in association with multiple myeloma, and it adds to the body of knowledge as one of the rare cases in which multiple myeloma presents with spontaneous tumor lysis as a result of aggressively proliferating disease. This case also raises the need for further study into high-grade multiple myeloma with the goal of developing therapeutic options better suited for such aggressive presentations. Thank you very much for your attention.